We're just having a wee chat here during the break to a psychotherapist. That's Christine Webber, and Christine's here to look at a new survey which has suggested more than a quarter of new mums are lonely after giving birth. How does it break down, Isabel?
Well, these are the details of the survey by AXA PPP Healthcare, and they show that 28% of new mums are lonely after birth. As we were saying, 28% say, though, they've made no new friends since the birth of their baby. And a third find it harder being a new mum than they expected. So quite depressing stats, really. It was, as you say, supposed to be such a happy time in your life.
Well, that's the problem, isn't it? That especially a first-time mother, everybody's saying, oh, you must be so excited. And you are. And you may have been a newsreader or a weather woman or a doctor or something really capable, and then suddenly you don't feel that capable. You feel weepy, tearful, and you feel shame. And that's the biggest thing, I think, that you think, I should be really coping well with this. I wanted this so much, and now I'm feeling terrible.
Does it help as to who you have around you, if you've got family support or if you've got friends of similar age and similar stage
I think
in
it really
life?
does help. And I mean, the survey does show that 24% of people have no family anywhere near them. Now, of course, you know, decades ago, that really wouldn't have happened. But
especially for people who are coming out to live in Britain from other parts of the world.
Well, it's a big thing for them. I think the most worrying statistic, actually, is that 20% of women are not availing themselves of antenatal care, and that rises to 40% in the much younger women. Now, that's crazy because, you know, we're always saying we don't get enough support for things, and that is there for people, and it's not only for the physical and mental health of the mum and the baby, and things get picked up, you know, during pregnancy, but you meet other mums, don't you? That's when you meet all the other girls that are going to give birth around about the same time. That provides you with a network, and if people aren't actually plugging into that, that's really something.
So you mightn't think you need this, but actually you do.
Yeah, I think so. Yeah.
I think it's such a shock that people don't realise you almost need counselling to have your first baby, because you don't realise you can be a very capable woman and have a great job and all the rest of it. But as soon as this child comes, it's wonderful for 2 weeks when everyone's visiting and bringing presents and your husband's at home, and then everyone goes and reality sets in that you have to look after this child all the time.
Well,
and
thank
you can't
goodness
do
for
what
men,
you...
I say then.
Is that right?
You can't do what you did before.
Well, you were very hands-on dad then.
I was there when needed. I have very fond memories. Babies remind me just talcum powder and sort of, you know, baby grows and that smell of puke, you know, that sweet smell of puke as opposed to an adult smell of puke.
I can tell you were really hands-on.
I was there at the time. And Isabel, this is something you have to look forward to. Are you looking forward to it?
I'm sure it'll be brilliant. I can't wait to have a go.
Well, maybe it's better to think it won't be brilliant, and then you might get a pleasant surprise. I think that's the thing, isn't it? The expectation, really. The other thing is, when people say, is there anything I can do? Say, yes. Thank you. Could you look after the baby while I have a sleep? Yes. Don't be ashamed to ask for help.
Don't be ashamed to ask for help. Christine, thank you very much indeed. Now to a woman who's had to go 3 times. And,
it's less of a shock the second time.
Right, OK.